Yeah, so this analysis further supports kind of what we already knew, which is that combination immunotherapy with a PD-1 monoclonal antibody and a CTLA-4 monoclonal antibody is superior to sort of our old standard of TKI. In this case, it was sorafenib, or one of two doses of lenvatinib. And the expanded analysis really shows that there's a much higher response rate across all subpopulations, including independent of different etiologies of hepatocellular carcinoma. So it supports its usage really across the board for this disease type. Yeah, so we've been waiting for the results of this for quite some time. We knew that Nivo/Ipi across different lines of therapy for this relatively rare subset of metastatic colorectal cancer, it's only about 4% that are MSI high mismatch repair deficient. But we know that immunotherapy is better than chemotherapy. We've known that single agent PD-1 monoclonal antibody is superior to chemotherapy. But what about 2 versus 1? We didn't really know the answer to that. And now we know that it does seem that 2 is better than 1 in this case, and with not a significant increase in toxicity, and with a much higher response rate, durability of response, progression-free or duration of response that really hasn't been met, which is quite impressive compared to single agent, which also seems to be beneficial and still beneficial relative to chemotherapy. But if we're really trying to maximize our response and durability of that response, we should probably be using the doublet approach. And in my patient population, for the younger, fitter, more symptomatic patients, I've been utilizing the doublet for some time. For older, sicker, more frailer patients who maybe not be as symptomatic from their disease process, single agent might be a better option just from a toxicity perspective. And I think that's probably still supported with this data. Yeah, so the work by Pasha and Kasi is really exciting. The NEST study is looking at giving these immunotherapy drugs for patients with mismatch repair proficient tumors that historically we don't think benefit from immunotherapy. But in this earlier stage setting, they seem to have relatively high response rates pathologically, and in some instances, pathological complete response rates. And the new data that he's presented or is presenting today is that it looks like the progression-free survival, there's no recurrence. So these patients, many of whom, I think almost none of them got adjuvant chemotherapy, despite that no one's recurred now in some instances over a year out. So it might change our treatment paradigm where we maybe should be giving a dose or two of immunotherapy, and then if there's a good evidence that there's some degree of pathological response at the time of surgery, then not needing to give adjuvant chemotherapy, which is quite toxic if these numbers hold. And we've seen this in other neoadjuvant immunotherapy studies in the MSI high world, where patients often didn't need further systemic treatment, that they had these long progression-free survivals, recurrence-free survivals where nobody has recurred now several years out. So it's very exciting, but still kind of early, small numbers of data. So I think some new data that was presented today was the phase 2 of the BOT/BAL, the Agenus drug, botensilimab, their CTLA-4 antibody that has a modified FC region that we think makes it maybe a little more efficacious, but also potentially better tolerated, plus their PD-1 antibody balstilimab. And they showed that across different cohorts of combining BOT at 2 different dose levels with BAL seems to be superior. And actually the lower dose of the botensilimab, 75 versus 150, seemed to be more effective and easier to tolerate, and had a response rate of 19%, which is on par with their phase 1 data. So interesting to see this then, catapulted into a phase 3 trial versus standard of care. Can we represent or recapitulate these results in, again, a metastatic microsatellite stable population without liver metastases? So that exciting times in the immunotherapy world for microsatellite stable colorectal cancer.